Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Very soon on the market, there may be a pill for treating COVID-19. In other words, if you pick up the infection, you get a prescription for this pill and you take it, and according to the manufacturer, which is Merck, a major pharmaceutical manufacturing company, it keeps you out of hospital and it keeps you around. So it could be a real game changer. So welcome to my episode, What to Know About the Pill for COVID-19. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. I want to thank you for tuning in today to the Invite Health podcast, and you can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Twitter, Instagram, and Facebook at Invite Health. The information on this episode is linked in the episode description, so let's get going. So in any event, this pill, which is made by Merck, and they just applied for emergency approval to treat COVID-19, because COVID-19 itself is quite an emergency. It's named after Thor's hammer. So anybody who loved Marvel Avengers or Guardians of the Galaxy like I did, they're familiar with the term Mjolnir, Thor's hammer. So this thing hammers the virus. It's called Molnupiravir. That's the drug name. And they're basing the request for early approval on interim analysis from data from about 800 patients, but these patients had mild to moderate COVID-19. And what the drug was doing, it was preventing the virus from replicating. If the virus can't multiply, then it dies out. It's as simple and straightforward as that. So according to this early analysis, according to Merck, the drug reduced the risk of being hospitalized by about 50% and reduced the risk of dying by about 50%, which is all great news. Now, the thing is, there's really added value to it. It really could be a game changer because it worked on all the variants, like it worked on the Delta variant equally as well as the other variants. And it even worked in people with all of those risk factors for developing really serious COVID-19 infections and winding up in the intensive care units. So people with severe diabetes or people with severe obesity were doing okay on this drug. But the added value is it also seems to prevent the virus from shedding. Shedding means one person spreading the virus to another. So in other words, this particular drug may help prevent the virus from hurting someone as well as them spreading the virus to other people they know. Now, the early safety data isn't bad. It could cause some insomnia. It could cause headaches. So it seemed to be fine. It was well tolerated. So let's keep our fingers crossed. Now, albeit we're talking about the COVID-19 pill, I really do want to talk about a couple of natural supplements that have helped people who are hospitalized with COVID-19. It's really worth mentioning this. One was a study on Sabenza's curcumin. In Sabenza's curcumin is the turmeric plant. And they have the entire plant in here, but they're naming it after the most common ingredient, which is curcumin. They add the black pepper fruit to it, which improves the absorption. Normally, curcumin, turmeric, is very poorly absorbed by humans. So in this particular situation, to improve its absorption, they're adding black pepper fruit extract, which they call piperine. And people who took it, who were in the hospital, they did a lot better. Now, it's a randomized, double-blind, placebo-controlled human clinical trial on 140 COVID-19 patients. And the patients who got the curcumin, and of course, all of these people were prescribed whatever the doctor felt they needed, whether they needed an antipyretic, that would be something to lower their fever, or something for their cough, or antibiotics, whatever the doctor felt they needed as a drug, they were given. Half of them were given the curcumin black pepper combo, the other half were given placebo. And what they found was the group given the curcumin, they gave it twice a day for 2 weeks. Their symptoms subsided a lot quicker. So they recovered from trouble breathing quicker, a cough, a sore throat, fever, aches and pains. But they also maintained their oxygen saturation more easily, above 94%. So let's discuss that very quickly because that's an important point. A healthy amount of oxygen in your blood, they call it an oxygen saturation, is 98%. And when it gets low, it's really dangerous. I mean, it can start destroying your organs and systems, your brain, your heart, etc. So one of the signs of COVID is a drop in the amount of oxygen in your blood, a drop in oxygen saturation. So they found that if they gave them the curcumin with the black pepper fruit, it tended to keep their blood oxygen higher, like 94, which is fine. That's not a bad level of oxygen saturation. It also shortened the time they stayed in the hospital. It reduced the death rate. It was preventing blood clots. It was reducing the need for ventilation. There were 2 deaths in the curcumin group. So this is 140 people, split between the curcumin group and the placebo group. There were 2 deaths of the people in the curcumin group, but 11 deaths in the people on the placebo. So it really did make a difference. But here's the thing. It's safe. There's data coming out on hydroxychloroquine and ivermectin. And it's really hard to figure out if these are helping people or not because some of the studies are just terrible. But there are a number of studies, and they do seem to help, especially the ivermectin does seem to keep people alive who are in the intensive care units. But there's a lot of side effects. There's no side effect with the curcumin, with the black pepper. Now, a second product that was studied, very interested. It was black cumin seed and honey, and it really worked. It was a randomized placebo-controlled human clinical trial. It's not peer-reviewed yet. The COVID-19 patients who received a combination of honey and the black cumin seed recovered a lot quicker than those given a placebo. On the black cumin seed with honey, symptoms were gone within 6 days. Without the black seed and honey, it took 13 days. Now, once again, these people were hospitalized and they were given all the drugs the doctors felt they needed. The paper is published in MedRx IV. That's like for studies that look very promising, but they haven't been peer-reviewed by a panel of experts yet. So it's a Dr. Saheb Ashraf. Now, he's a pretty smart cookie. He's at Harvard Medical School, and he's at Massachusetts General Hospital. And what happened, he saw that he's from Pakistan. People were dying like crazy from COVID-19 in Pakistan, so he figured he should go there and help. So he and his co-researchers looked at all the data on, what stops inflammation, what stimulates the immune system, what protects the lungs, what prevents blood clots, what fights viruses. And they found through their research that both honey and black seed fit the bill. Oh, by the way, they also found when they gave the patients the black cumin seed along with the honey, they had a negative PCR test much quicker. A PCR test looks for the DNA from the virus. So it tells you if you recovered. And they found that the people given the black cumin seed with the honey, they had a negative PCR test 4 days or more earlier than the people on the placebo. So the trial was conducted in May through July 2020, and these urgent care places, 4 different medical institutions treating COVID-19. It was 313 patients, so that's quite a big size. 210 of these people were moderate cases. Now, they had a cough, they had a fever, they had sore throat, their nose was stuffed, but they also had shortness of breath. So that's scary. And they were in the hospital. 103 were severe cases. So they actually had pneumonia. They had, the fever, the cough, the pneumonia. It was hard for them to breathe. They had respiratory distress. So they gave them the drugs, and whoever needed the drugs were prescribed the drugs, but half got the placebo, the other half got the black seed with honey. And they found that all the COVID-19 patients given the black seed with honey did better. They just did better. Their COVID-19 symptoms were alleviated 4 days earlier in moderate cases and 6 days earlier in severe cases. Oh, I apologize. That's incorrect. The COVID-19 symptoms in moderate cases were alleviated in 4 days versus 7 days in the placebo group. And for severe cases, their symptoms were gone within 6 days versus 13 days in the placebo group. And the viral clearance on the PCR test was 4 days earlier on average for both the moderate and severe cases. But it reduced mortality, even among the severe patients. In the moderate cases, 97% were back to normal within 10 days. Not anywhere near that in the moderate cases on placebo. In the severe cases, discharge occurred by day 10 on the black seed with honey, where the other people were still in the hospital. But here's the thing. Let's look at 30-day mortality. In the severe cases on the black seed with honey, there was a 4% death rate, whereas with the placebo, there was a 19% mortality rate. Now, black cumin seed is used for a lot of things, but it's fantastic for lung health. So that's a real added benefit because COVID-19 tends to get vicious in the lungs. What happens, especially if you're lacking vitamin D and zinc, your lungs start to fill with fluid and you're put on oxygen or a ventilator, which is not a good thing, a mechanical ventilator. Needing that is not a good sign. And it's because they develop acute respiratory distress syndrome where the lining of their lungs is flooding with fluid. So the black cumin seed with honey was preventing acute respiratory distress syndrome. It's very good for the lungs. I use it all the time in people with allergies. It helps with allergies. I use it all the time in people with asthma. It helps with asthma and other chronic obstructive pulmonary diseases. The black cumin seed is very helpful for them. But in vitro studies shows that the black cumin seed inhibits the replication of SARS-CoV-2, which is similar to what the drug does. Now, what about honey? Why would honey help people with a viral infection? Honey is a microbe-killing powerhouse. It has superpowers. First of all, honey is a supersaturated solution. So what does that mean? Normally, you can only mix a certain amount of sugar with water. Honey has a lot more sugar dissolved in the water than you could normally accomplish. It's done by the bees. These sugars are glucose and sucrose. I mean, that's one reason why when you have honey, as it dries up, it creates crystals because all the sugar's coming out of it. I mean, all the fluid's coming out of it. So honey is mostly sugars, not totally, but mostly, and it's only about 17, 18% water. Now, because of this, honey is incredibly thirsty for water. So what happens with a microbe like a bacterium? If you have the microbe and you put honey on it, it drains all the fluid out of the microbe and the microbe dies. So that's one way honey controls infections. It drains the microbes of fluid. But honey also contains an enzyme called glucose oxidase. And glucose oxidase converts the glucose, into two things. Peroxides. Now, peroxides dissolve the outer structure of microbes. So they die. But the glucose oxidase enzyme also creates out of the sugar something called gluconic acid, and it is indeed an acid. So if you look at the acidity, the pH of coffee, it's generally around 5. The pH of gluconic acid is 4. Now bacteria like a neutral pH of about 7. So let's explain what the pH range in it is. pH is a measure of acid, neutral, or base. So acid would be very low, like between 1 and 7, less than 7. Neutral is 7, and above 7 is base. So like sodium or lye is very basic, whereas battery acid and other types of acid are very acidic. So gluconic acid has a pH of 4. Bacteria like to live at a pH of 7, which is fairly neutral. That's why you can have bacteria in your intestines, but not really in your stomach where all the acids are. So the acid kills the bacteria. But also, honey has something in it called B. defensin 1. B. defensin 1 is this protein that's really an antibiotic. B. defensin 1 does exactly that. It defends bees. It's part of their immune system. It's part of their immune defense. It kills germs. Now, they make it in a gland, and it's the same gland that bees use to make honey, so some of the B. defensin 1 winds up in the honey. In fact, there are hospitals that use a standardized purified honey to treat wounds and infections in the hospital. And the strongest honey for infections, by the way, is Manuka honey. That's the best one because it's loaded with these things. Now, other natural things that have helped, in Northwell Health out here in Long Island, they give vitamin C infusions to COVID-19 patients. That's very interesting. Vitamin C is needed by the immune system for chemotaxis and respiratory burst. Chemotaxis is the ability of the immune cells to navigate to the site of an infection. And without vitamin C, they can't travel from site A to where the infection is. So you need a vitamin C for the mobility of the immune cells. If the immune cell, the neutrophil, is in your underarm, it's not going to help an infection that's forming in your nose or mouth. So vitamin C gives it the wherewithal to travel. And vitamin C is needed for respiratory burst, which is the ability of your immune cells to kill the virus. And normally when you get an infection, it soaks up all the available vitamin C, so there's not much left over. So giving additional vitamin C by infusion, which means injection, according to the doctors at Northwell Health, is helping these patients stay out of intensive care and recover better from COVID-19. So that's one natural thing. Another is glutathione. Glutathione is a master antioxidant in the human body. There's a couple of case studies that when they gave people with COVID-19 affecting their breathing, that within a half an hour to an hour, their breathing came back. But once again, that's just case studies. Now, I do recommend, especially in the winter, that everybody gets some zinc, some vitamin C, and vitamin D. All three of these are needed by your immune system, and all three of them start to drop in your body around October. So flu season is technically from October to May, but really most people get sick around Thanksgiving through January. That's when it generally is the worst part of the flu season up here in the north. But that's also when you have your lowest blood levels of vitamin C, zinc, and vitamin D, all three of which are needed by your immune system to fight viruses. So I tell people, listen, at least in the winter, make sure you're getting vitamin C, make sure you're getting zinc, make sure you're getting vitamin D. So, by the way, that curcumin that was used in that study of COVID-19 patients is readily available. For instance, Dr. Pressman makes that particular curcumin that we spoke about earlier in the podcast episode. So thank you for tuning into the Invent Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit inventhealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Facebook, Instagram, and Twitter at Invite Health. I hope to see you next time on another episode of the Invite Health Podcast. Thanks for listening. Jerry Hickey signing off.